Hi everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today we're diving into an exciting new category of therapies for a rare disease called hereditary angioedema, or known as HAE. One thing you may not know is that 2025 is shaping up to be the year of HAE in allergy and immunology. By the end of this year, we expect to see 3 new FDA approvals for hereditary angioedema. And as of mid-year, 2 medications are already officially approved. The first one we'll cover today is Andembry, the first FDA-approved prophylactic treatment that targets the very top of the HAE pathway. Hereditary angioedema is a rare, potentially life-threatening condition caused by unpredictable swelling attacks that can affect the skin, gastrointestinal tract, and even the airway. For decades, prevention strategy has meant frequent dosing or IV infusions. But Andembry marks a new chapter, first-in-class therapy with a once-monthly injection that targets the disease at its upstream. In this video, I'll break down 5 key things you need to know about Andembry, what it is, how it works, how to take it, how effective it is, and what to expect when it comes to safety. If you're new here, don't forget to like and subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Andembry? Andembry, also known as Garadacimab, is a biologic monoclonal antibody recently approved by the FDA as the first ever prophylactic therapy that targets activated Factor XIIa for patients with hereditary angioedema. Until now, long-term prevention relied on therapy that targets C1 esterase inhibitor or plasma kallikrein. This worked, but often required more frequent dosing, multiple injections, or IV infusion each month. Andembry changes that by offering a once-monthly under-the-skin injections approved for adults and adolescents age 12 and older with hereditary angioedema. For many patients, this means fewer treatments, less burden, and a more convenient way to keep swelling attacks under control. Second, let's talk mechanism. To understand Andembry, we need to look at the kallikrein-bradykinin pathway. In hereditary angioedema, uncontrolled activation of Factor XII leads to overproduction of plasma kallikrein. That in turn drives excessive release of bradykinin, the key chemical responsible for swelling attacks. Andembry is a monoclonal antibody against activated Factor XII, also called Factor XIIa. By blocking Factor XIIa at the very top of the pathway, it stops the chain reaction that produces bradykinin. Think of it as turning off the faucet rather than mopping up the puddle. By shutting down the initiating step, Andembry provides stable and durable control over HAE attacks. Third, how do patients take Andembry? The recommended dose is 200 mg given as a subcutaneous injection once a month, using an auto-injector. It is approved for adults and adolescents age 12 and older, and does not require weight-based adjustments. But as a reminder, to quickly reach effective blood levels, Andembry starts with a loading dose. That means 2 injections, 400 mg total in the first month, followed by the regular monthly 200 mg injection. And important, because this is a preventative therapy, it is not used for treating acute swelling attacks. Patients will still need to keep an on-demand rescue option on hand. Fourth, let's look at efficacy. In pivotal clinical trials, Andembry reduced monthly HAE attacks by nearly 90% compared to placebo. For moderate to severe attacks, the reductions was even higher, about 94%. It also reduced the need for on-demand therapy about 90%. Another benefit is rapid onset. Protection begins as early as week 1, and the effect is sustained long term. with data supporting up to 2 years of continued benefit. In short, Andembry offers powerful and durable protection, helping most patients experience far fewer attacks, with many achieve complete freedom from symptoms. And finally, let's discuss side effects and safety. In clinical trials, Andembry was generally well tolerated. The most common side effects were injection site reactions, nasopharyngitis, both infectious and non-infectious, and abdominal pain. Injection site reactions, such as redness, itching, or bruising, were seen in about 14% of patients. But importantly, there were no report of injection site pain, which suggests a more comfortable safety profile. No cases of hypersensitivity or anaphylaxis were reported in the pivotal trials. Still, patients should be encouraged to report any persistent or concerning symptoms to their healthcare provider. And there you have it, 5 key things you need to know about Andembry, the first activating factor XII inhibitor approved for hereditary angioedema prophylaxis. It brings a new mechanism, simpler dosing, and potent prevention for patients living with this rare but serious disease. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the following comments. Thanks for watching, and stay tuned for more evidence-based updates right here on Medician. See you next time.